Hello again, I'm Dr. Mikki with Medtrine Health and Aesthetics. In the last video, we were discussing about Botox and we reached almost to the DAO, that is this muscle right here. So what is that muscle? What does that do? So as we are aging, we've noticed that our mouths are going down, looks like a sad mouth. That's because the DAO, its function is to pull the mouth down. Okay, so what can we do to prevent the downward pull of the mouth is relax this muscle so it's not going to pull it down, so at least it's going to give you a nice youthful appearance. Okay, so that's a good area to target. And the next in the lower face I like to do is the mentalis, that is the chin muscle. As we are aging, the muscle gets pretty active, causes dimpling of it. So giving some Botox in the mentalis will smoothen out your chin. It looks nicer and youthful. Okay, so once we're done with the lower face, now we can go into the neck. Is Botox given in the neck? Yes, absolutely. The most common areas that I see it often given is the platysmal bands. It's not evident in here, but so this is the platysmal muscle, but you cannot see the bands. Certain women, certain people have a tendency to get like a strong platysmal bands. So when you do it, you see big cords popping out. That is not usually liked by people who get those. It's not for everyone, but there's a good tendency of certain people developing the bands. So what we do in those situations is take Botox, hold the platysmal band, and inject into those bands so it relaxes those bands and it gives the softening appearance so it's not so prominent. Okay, so that's the Botox that we talked about, face and neck. And how often is Botox given? Usually about 4 months as an average. Some people could require a little sooner and some could require a little later. How do you know when it's time? Is when you start noticing movement, it's time for your Botox. Also, good to be aware of, it could take up to 2 weeks depending on which neurotoxin you take for a touch-up or to see what it's done for you, if you need more and whatnot. So give it 2 weeks before you go in for a follow-up to make sure if any area is requiring any additional amount. Are there any side effects with Botox? Not really. The only problem, what can happen, is the drooping of your lid and brow if the toxin migrates into the lower frontalis muscle. That can be fixed, but again we have to give